What's up, everybody? Sonoma County Supervisor James Gore. Just sitting here with an apple that was given to me, a good Sonoma County apple. So let's talk about the impacts of the Trump big ugly bill on our local services and what we did today at the Board of Supervisors. First things first, from settlements that we had, multi-billion-dollar settlements that we joined in around the country, we have in Sonoma County received $14 million that we have put out as of today in opioid settlement dollars. So we're talking about all the stuff that was oxycodone and all these other things out there over the years that were poisoning our communities, and the settlements that went through that the pharmaceutical companies paid in. And here in Sonoma County, the $14 million went to a variety of resources, increased psychologists in our system, drug prevention programs, with the things that we deal with fentanyl, and we didn't do our narcotics team with the sheriff's office. We did that with other money, our general fund money, but this is for Narcan and programs and bringing people out of addiction and into the community again. But we also are building housing. There was a great proposal from Buckelew, a great local organization that does housing for individuals who have gone through substance abuse and are getting back on their feet. And it's just amazing work. So I really want to thank them and others for putting an amazing proposal. At the same time, we talked about not just that issue, but overall, what are going to be the impacts of what I call the big ugly bill on our communities and on specifically our delivery into the individuals who live in our county. And I just finished being the president of the National Association of Counties, and we estimated that out of this big bill, there was $1 trillion over the next decade in money that's cost shifted to counties and therefore into communities. You've all heard the numbers, anticipated 12 to 17 million people coming off of healthcare, which is called Medicaid. Here in California, we call it Medi-Cal. And then another series of cuts, hundreds and hundreds of millions of dollars beyond that, in cuts to SNAP, which is the Supplemental Nutrition Assistance Program, formerly called food stamps. These are the food and feeding programs out there in our communities. And so between those two, we're talking about, in effect, $1 trillion a year and, 800 billion, $1 trillion in cost shifts over the next decade. We still got to take care of folks. That's the difficult part of this, is that, we still do what they call indigent care, which means least fortunate, underserved population, not to be confused with indigent care. And so we're going to still have to operate clinics. We're going to have to do all this work. And so there's a big conversation about preparing for those impacts, how we budget for them, how we take care of people, and what happened before the Affordable Care Act was passed that brought 15 million people into health insurance. We had some conversations, and some of the individuals here at the time in the county said that, what the difficult thing is, what that really means is for all these individuals who are on Medi-Cal, which in the federal area is Medicaid, and all these programs, we still take care of them, but it really means that we move from preventative care back into the days of emergency care and emergency room care and other things like that. So we're trying to do our best to figure out what that means. We went over some of the budgeting for our behavioral health, mental health, substance abuse programming, and some of the things that we need to pass. But I just want to let you know that we're working our butts off here. In spite of national news being overwhelming and in our faces all the time, we are delivering locally, doing it with authenticity, with empathy, and practical budgeting. So just here to serve you as always, and have a great Tuesday.